Hi, I'm Dr. Lowry with Injury Care Centers in Jacksonville, Florida. We have 8 locations, and today we're going to be discussing sacroiliac dysfunction or pain. So when patients come in and they have back pain, a lot of doctors tend to put it in the just lower back category as far as like disc injuries and muscular spasms or those type of pain. What we do here, the way we like to assess it is it a pelvic issue or is it a lumbar spine issue? It's important to separate the two. And I get patients that are sent to me because it's a pelvic issue, which is sacroiliac. And the sacroiliac is made up of the sacrum, which is the main bone of the pelvis, and then the ilium itself, which is the larger pelvic attachment. So that forms the sacroiliac joint, and that is a movable joint. So it's important because when you walk, your sacroiliac joint moves. So if we were to look at the spine and the sacroiliac joint was attached on each side, when you walk, you have this type of movement. Okay, so you have kind of a flexion extension type of movement. When you have sacroiliac dysfunction, typically it'll be on one side, either from an injury, it could be from a fall, like for football players, if they fall on their backside and jam it, people have come in, they've fallen off horses. So it's a large joint, it's kind of built like an elephant ear, and when you don't have mobility in that joint, your pelvis has to work around it. So the dysfunction that works around it causes the pain. So typically with a joint that the sacroiliac is not moving properly, instead of having the movement here, you're going to recruit higher in the back and you're going to start recruiting areas that you have usually disc dysfunction. So your pelvis will not be symmetrical in its movement. So also the muscles that are attached to the pelvis, they'll either start to atrophy or they will be start to become more spastic. You could have piriformis entrapment. You'll have more gluteal type issues, so glute max, glute minimus, medius, minimus, and piriformis, which make up the actual glute itself. So one of the things that I do when patients come in, I designate, okay, is this a lower back issue like sciatica, or is it a piriformis issue or a sacroiliac issue? So one of the things you look at is the pain pattern. When someone comes in and they say, well, I have pain that goes down to my foot. Okay, I have low back pain that involves my leg. Okay, does it go all the way to the foot? So true sciatica goes all the way to the foot. Okay, if pain stops at the knee, that's going to be more sacroiliac. Also, I have people that come in for sacroiliac dysfunction, men, that one of the trigger point referral patterns for sacroiliac dysfunction is the groin. So groin or testicle. So if you have severe sacroiliac or sacroiliitis, you can have referral to the groin or the testicle itself. So that's one of the main patterns that also is not picked up on. So when you evaluate your patient for lower back pain, look at it as, is it a disc issue versus a lower back issue or a pelvic issue? You can have a combination of both. You know, if you have a history of like disc herniations along with it, then it complicates it. But what you want to look at is where's the function. So I focus on function. At injury care centers, we tend to focus more on function, and that's why we want to get into, things like proper posture, proper function of the joints, not so much chasing the pain. The pain can give you some insight into what type of problem there is, but when you look at the function, know how to assess function, then that'll tell you where the problem is. So by restoring function, you will see that the pain decreases. Typically, they'll go hand in hand. So with sacroiliac joint function, athletes, very important because you cannot function at the level that it takes to compete as a professional athlete. You know, whether you're a tennis player, you're a soccer player, football player. If you have sacroiliac dysfunction, if you have a previous injury where you fell and didn't think much of it and you noticed, well, I've had back pain ever since. So today we're going to look at how to assess a sacroiliac joint that's not working properly, how to fix that, and we can use different therapies. We have different therapies we apply. Some patients don't like to have a popping or cracking, and that's why they don't want to go to a chiropractor, so we do things like pelvic blocking. You can block the pelvis, which is called sacro-occipital technique, which will restore balance to the pelvis. You can use activator tools, which is an adjustment tool, arthrostim, different non-thrust types of adjustment tools to get function back to the pelvis. What we're going to show today is more of a manual manipulation where you're actually physically moving the sacroiliac joint. Has a quicker remedy to the pain, restores the function pretty fast, and then you have to look at, okay, how many times does it take to adjust to retrain that joint? Because what you're doing is really postural correction. You know, your posture and your frame is not going to be in a neutral position with a sacroiliac joint that's dysfunctional. And with floors level today, you know, everything is very, very flat. Everything is measured. So when you have dysfunction in the pelvis, then you're going to feel it in your neck. You know, you're going to notice, well, I have low back pain or sacroiliac joint on the right side. I wonder why my right side is always inflamed, or I get headaches on the right side. So just your stance, how you stand all day with an dysfunctional sacroiliac joint, you know, you're going to shift your pelvis. You probably notice, yeah, when I sit in my seat, I always shift to the left. It takes the pressure off my back. Typically what you're trying to do is you're trying to correct your pelvis. Okay, your pelvis is in a position that you're trying to neutralize it to take the pressure off the spine. So we're going to look at a patient today with sacroiliac dysfunction, and then we'll assess it and then show the correction for it.